Welcome everyone to the 2020 conference, apart and yet together, under the same friendly atmosphere that I've always been proud that the ABP has been able to cultivate. We were just chatting before we began that we feel excited, just like we do before our usual annual get-togethers, and we hope that you do too, so that we continue to be the virtual home and voice of business psychology. We've got a really great timetable ahead, and what I'm especially pleased to see is that it's not just a series of Zoom calls that you're going to be dialing into. Sure, we do have speakers who are going to be imparting their knowledge, their wisdom, their research, their learnings to us all, but there's also panel discussions, we have trainings, we have chat rooms, networking. We've even got a virtual awards ceremony, so I expect you to bring along your handcrafted cocktails and maybe not black tie, but sure, go for your life, and we'll have a great evening next week to hand out the awards. Take a look on the conference website to see who we've shortlisted for that too in advance. Obviously, this is an innovative format, but it does also have its challenges. I guess one of the things that we were particularly concerned about was around the whole area of networking. So people have come to me and said, the ABP is, it's a really friendly, welcoming association, but sometimes it can be a little bit intimidating to go up and introduce yourself to someone for the first time at the live events. So the fact that we've got our dedicated chat room, the fact that we've got our dedicated mentoring system as well, hopefully will mean that everyone feels very comfortable in just initiating a discussion with others, both after specific talks, but also just in general. Also, we have the conference, as Gonzalo said, spanning a 2-week period, and we're aware that everyone is very busy at the moment. This is why we've got the live sessions, then we've got the evening sessions. So hopefully it's really flexible, regardless of your working status, that you'll be able to attend as many sessions as possible. I guess you can see that the conference dean is a behavioural economist. The pay what you want system for the tickets, I think, again, it was something that was quite innovative, something we're perhaps a little bit nervous about at first, but I'm pleased to say that's been a real success. I think it's really enabled those who perhaps are experiencing tougher times at the moment to still attend for as little as £1, but for those of you who can afford a little bit more, you can help to offset that and facilitate it. So it's a really nice illustration of karma in process, hopefully. The last thing I wanted to say is that obviously this is the 20th anniversary of the Association for Business Psychology. It still feels like a really young organization. If you would like to hear a little bit about the history, so where we came from, why it was originally set up, then we have Brian Baxter speaking next week about this. I guess those founding members of the ABP probably, well, they couldn't have envisaged the situation we'd find ourselves in 20 years down the line, but hopefully they'll be proud at what we've been able to create spontaneously, quickly, and responsively. And I guess those are all characteristics that I think the ABP embody.
Good morning, everybody, or good evening, because apparently it's going to be shown at 6 o'clock as well. I wanted to take a look at the issue of mental health in the workplace. The way I'm going to do it, actually, is take a look at pre-COVID, what we found, what were we doing in this kind of space, and showing you actually how much more relevant it is now. And remember, pre-COVID, things weren't, the greatest in a way. Remember what we had was, and you'll see it in a minute, 57% of all long-term sickness absence by the HSE was due to stress, depression, and anxiety. This is pre-COVID. Plus, the OECD had done a study of all OECD members to take a look at mental health and what it was costing the economy. In the UK, it was 4.5%, would you believe, of our GDP. Every year, very expensive. So what I'm going to do is go through, take a look at the costs of it, what causes it, show you how important it is now during the COVID era and recession. Now, do remember one thing which is really significant. It's not just about COVID. We are entering the worst recession in a lifetime. And I mean, makes 2008 look like a peanut factory. I mean, that is really big time we're going to have. So it'll be more like the depression of the 1920s. Plus, we have one other factor. So we have the health one, we have the economy, and of course, what do we have? The B word. We have Brexit hitting us in January. Add that all together and we're talking about a lot of stress around. So my books are going to do reasonably well in the next 2 or 3 years. Anyway, could you move to the next slide, please? All right. So this just gives you pre-COVID, just pre-COVID, you can see 57% of a long-term sickness absence was due to stress, depression, anxiety. It used to be in the good old days, 10, 15 years ago, musculoskeletal was big. Now it's only 25% of the long-term sickness absence. Next slide, please. And this is interesting because this is very important because we always talk about sickness absence, right? The problem in measuring sickness absence is when you have big economic events. So these figures are from just during the beginning of the recession of 2008, 2007, 2008. Now, the economist at the Sainsbury Center for Mental Health took a look at two things. One was absenteeism, obviously, and it said it cost in that year 8.4 billion. But then they were looking at presenteeism. I'm going to tell you what presenteeism is in a minute, but I think most of you know anyway. And by the way, presenteeism isn't just going to work sick. It's actually going to work sick, job dissatisfied, or whatever, contributing absolutely no added value to the business. You're there showing face time. And why are you doing it? Because you're worried about your job. You think being present will protect your job. Incidentally, it doesn't necessarily. So that's kind of double. Next slide, please. Thanks. Okay, so look at, we have in the UK or any other country, what we want are people in the top left-hand box, don't we? We want them healthy and present, right? And there's another box over there, which is we're not absent, we're unhealthy, we go to work ill. So it's called sickness presenteeism. Our health is not good, but we have no absences. Doesn't mean, by the way, you have no problems as a workplace. And in fact, this is going to be extremely important in the coming months and year or two of the recession, because this was found to be really big during the last 2008. 2007, 8, 9, 10. I went on until probably 2015, really. Okay, and the diagram says we have some absences. You're healthy and not always present. And that's because your job dissatisfied. You turn up, please leaves on the line, anything not to go to work. But then there's always the not healthy and always present. Well, we did a big study taking a look at 39,000 people in a range of different jobs, looking at presenteeism. Next slide, please. So you won't believe this, but look at this. Only a third of people of the 39,000 we looked at were healthy and had no absences or few absences. So a third of you buggers are actually paying for my pension. So we did this time during the recession. So you're seeing that only a third of people were actually very productive. It's not surprising when you consider productivity per capita in the UK. We're doing really, really well. On the G7, we're tied with Italy at the bottom, just a little bit below Italy. So we're actually 7th in the G7. And in the G20, we're 17th out of 20. Not good news. So if anybody thinks that we were doing well pre-COVID, we weren't. Our sickness absence rates in Europe were the highest. Our productivity per capita was the lowest. Our mental health rates were extremely high in the workplace. So really, this is an opportunity to reset. And why I say that is, and this is great. You got to hear this poem. This is a fantastic poem during the pandemic. Listen to this poem. And people stayed home and read books and listened and rested and exercised and worked and made art and played and learned new ways of being, and were still and listened more deeply. Someone meditated, someone prayed, someone danced, someone met their own shadow, and people started thinking differently, and people healed. And in the absence of people who lived in ignorant ways, dangerous mindless, heartless. That's not wearing masks, for example, no social distancing, all right? Just to put the thing in. The earth began to heal. And when the danger ended, and when people found themselves, they grieved for the dead, and they made new choices, and they dreamed new visions, and created new ways to live. And they healed the earth fully, just as they had been healed. That poem wasn't written now. That poem was written by Kathleen O'Meara in 1869, when there was a pandemic then. So it's interesting. What she's effectively saying is we have an opportunity to reboot. Let's reboot. Let's see how we can make the workplace a better. That's our job as a business and organizational psychologists, is to do something to create, improve our productivity per capita, get our sickness, mental health sickness absence rates down. Let's be more productive. That's what we need to do. Next slide, please. Because these are the figures, again, pre-COVID. Not good. 4.5% of our GDP is lost every year, right? Due to mental health of one sort or another. Cost each employer £1,035 per employee. You can see all the stats. They're there. They're pre-COVID. Now we're going to change it. And we have an opportunity to change it, and I'll talk about that. You know, we're going to be working more flexibly. We're going to get better managers. We're going to do things, and these are going to be kind of significant things for all of us. Okay, so let's go to the next slide. So you got the business case for it. It's out there. Now, we know, as an academic's been working in the field of stress and well-being and mental health in the workplace for many, many years, we already have enough studies. We don't need any more studies. We know what causes people stress. Probably we need more studies on things like what's social distancing going to do in the workplace? How are managers going to manage people, some of whom work remotely and some of whom come into a central office environment? We're going to need new studies of that sort linked to COVID and potentially linked to the recession as well. But basically, these factors on the left-hand side are factors that influence us, and they lead to symptoms of stress, individual and organizational. Most of us who work in the workplace look at the box at the bottom. We're looking at high absenteeism or presenteeism or labor turnover or poor quality control or accidents at work. And all of those factors on the left influence the symptoms you get, and ultimately we know that stress and lack of mental well-being affects disease processes of one sort or another, both physical, mental disease, and so on. And the model just says if you don't deal with the problems on the left, you get the problems on the right. All right? Okay, so let's go after one of these, one at a time. Next slide, please. So factors intrinsic job. Are we going to have more work overload? Boy, are we. We're going to have fewer people. Come on, guys. What we're going to see is the following. A lot of furloughed people will lose their jobs. That's reality. We're entering the big recession. And just anybody out there is vulnerable now, and they all know it. And in fact, if you take a look at the ONS did a survey on the 7th of May, during the middle of this COVID thing, and they do what they call a well-being survey every quarter of 250,000 people. 63% of those people during COVID said they were suffering from stress, depression, or anxiety. 63%. And one of the biggest causes of it is their worry about work, worry about their finances, what we call financial well-being. Big time issue. That was during COVID. That's even before the recession, because we were still furloughing people and people were reasonably well protected then. But as the end of this month, they are not going to be. And then we're going to have the true costs, I think, of this. So what are we going to have? We're going to, the model just says, we're going to have fewer people, they're going to be overloaded. The other thing we're going to have, by the way, is we're going to have underload. Because underload stress is when people feel their boss knows they don't have much to do. And given their job insecurity levels, they're going to be very worried. Joseph Heller wrote a book called Something Happened. You know Joseph Heller? He's a great guy. He wrote Catch-22, right? His first book was about somebody having a stress breakdown in the workplace. It was called Something Happened. Brilliant book. and it's a fun book, but it also is quite serious. So listen what he says in his book. This is a fictional character. He says, a middle manager, I am bored with my work very often now. Everything routine that comes in, I pass along to somebody else. This makes my boredom worse. It's a real problem to decide whether it's more boring to do something boring than to pass along everything boring to somebody else that have nothing to do at all. So underload as well as overload can be a problem. Next slide, please. So factors intrinsic to the job. One of the very first studies I ever did many years ago was at Manchester Airport. I was looking at air traffic controllers. And these are factors intrinsic to that job. Variable workload, high workload, poor procedures by pilots, like the international language of air traffic control is English, and a pilot could fly over and speak Portuguese, creates 1 or 2 problems for air traffic controllers. Anyway, you get the message. There's a whole range of kind of factors that can influence us in our job, right? Some of which we can deal with. I mean, some of which air traffic controllers can't deal with. They have the lives of people in their hands. But there are things we could do about their shifts and everything else. Next slide, please. So factors intrinsic is one. The role you play. We know about this, don't we? The role people play, the less ambiguous, the less there's role conflict in it. But what is really important, and where there's tons of research, is on the issue of autonomy. Do people feel they have control over their job? They have control over their job. That's going to be good. Now, here's the good news of what's happened in COVID, and I hope will change us all. Prior to COVID, most organizations allowed people options for flexible working. The evidence was that men tended not to take it even though they were offered it. Women tended to take it of necessity. Why didn't men take it? I did a big study funded by which I worked with working families, and what we were looking at is we were looking at why men don't take it, you know, and why men didn't take it, so it would adversely affect their career. When we asked women why, the women who took it, so I wanted to take it, but I still think it, and I took it because of necessity. I have to look after kids, I have to do elder care like women always have to do. Men tend to focus on their career, but women said it was going to adversely affect them too, but they had no option. We know we have a new man somewhere, but I don't know where he is. I think he's touring the country, and I think he's in Aberdeen at the moment. So the issue we have, the good news I think from COVID is this. Control at work and autonomy at work means if you want to work flexibly, you can. Now, what has really changed dramatically is we said we can all do it now. We've seen it. We've just gone through 6 months of it, right? It hasn't been very pleasant, by the way, particularly for people with kids. Because why? Because they had to do homeschooling. Forget the homeschooling now. We're not going to have that as a problem. We can now do it. Employers see that we can do it. Then employers say to themselves, I got to keep my costs down. There's a recession going on. So what are employers going to do? Employers are going to downsize their estate in Manchester, London. So their office space is going to go down so they can save money because we're going into a recession. So they're really behind it now, right? But the issue should be this. People shouldn't be forced to work exclusively from home because that's not what people want. The vast majority of people want flexibility, but they want to also go into a central office from time to time to meet their social needs, to team build, to do all that kind of stuff, all right? So I think this is a really critical area where we have seen that now we have the possibility of giving people more control over their working life, not to get work-life balance, but to get work-life integration. That's what we need. Next slide. This is about role. Oh yeah, just to show you that when you look at a role of an occupator, I did a big study for the BDA, British Dental Association, and the California Dental Association many years ago. And these are the kind of factors that influence them. But there's quite interesting, every role is different. Everybody thinks, for example, that a dentist standing up in front of you, it's standing up, it's looking into people's mouth, ugh, horrible. But actually the things that cause dentist stress are patients perceiving them as an inflictor of pain, dealing with difficult patients. We know you guys out there hate going to dentists. You know, and yet, so the dentist has a social interpersonal role to play. And now dental schools kind of understand that dynamic and how important it is. And that's why these kind of studies are useful, because it says maybe we need to train dentists on their social skills as well as their technical skills. Next slide. Third factor is relationships. This is probably the most important thing. Okay, now, I think we knew pre-COVID, that probably the most significant factor in terms of your relationships at work for your health and well-being is your relationship with your boss. Very critical dimension. We know you guys out there have great bosses who tell you every day what a wonderful job you're doing. But there are quite a few people in life who don't have that. And in fact, quite a few people don't have that. And do remember this, and this is what I think is really important here, is you look at, I'm in a business school. What do we do when we train managers? We train them cognitively. We don't train them emotionally. We train them on understanding HR, understanding organizational behavior, understanding organizational psychology, economics, operations management, everything that you want to treat as an undergraduate in management or doing an MBA or whatever. Do we train them on their social interpersonal skills? We do not. Would you put an MBA graduate from most business schools in front of a group of people and say, manage them? You would not. They're not trained to do that. That's a problem we have. And so what we found pre-COVID was probably the most significant factor of all the factors that predicted ill health was the management style of your boss. If you had a boss that was had a kind of rewarding recognition type management style as opposed to fault finding, somebody who encouraged you, gave you negative feedback when you needed it, but in a constructive way, but valued you, trusted you, let you know and recognized you when you did a good job. That's the kind of boss we need. But if you look at the reality is people are promoted to managerial jobs based on their technical competence, not their people skills. You could be the greatest manager on earth, but if you don't hit the bottom line, really the bottom line is it. And there are lots of different bottom lines. So what we need, and what this illustrated, what did COVID illustrate more than anything? It illustrated that the people who did well working partly from home, worried about their health, worried about the future, worried about the recession, worried about their job, the ones who did best were the people who had bosses who contacted them on a regular basis, every day, did one-to-one Zooms or one-to-one Skypes or whatever the hell the social platform was, right? So this probably is the most important factor that we should learn from COVID, and we have to learn about going to the next recession. We're going to have fewer people. They're going to be feeling really job insecure. They're going to start working longer hours, and they'll burn their bloody selves out. And what we need are socially skilled managers to deal with this. So here's the imperative. Now business schools have to focus in not just on the technical, cognitive aspects of management, i.e. knowing about the principles of HR, knowing about the principles of operations management, economics, etc. They're going to have to help develop their social interpersonal skills, i.e. EQ, their emotional intelligence. Listen to Heller. I love this. This is Heller's opening paragraph of his book, Something's Happened. He was a guy, by the way, Heller, when he wrote Catch-22, and he actually worked in an insurance company for years before he started writing. Listen what he wrote. He was talking about relationships in the workplace. Opening paragraph of his book. In the office in which I work, there are 5 people of whom I am afraid. Each of these 5 people is afraid of 4 people, excluding overlaps. And each of these 20 people is afraid of 6 people, making a total of 120 people who are feared by at least 1 person. Listen to this. In my department, there are 6 people who are afraid of me. And 1 small secretary is afraid of all of us. I have 1 other person work for me who's not afraid of anyone, not even me, and I fire him quickly, but I'm afraid of him. The thought occurs to me often there must be male clerks, assistants of all kinds and ages who are afraid of everyone in the company. And there's a typist in our department who's going crazy slowly, has all of us afraid of her. Her name is Martha. Our biggest fear she'll go crazy on a weekday between 9 to 5. We hope she'll go crazy on a weekend when we aren't with her. Now, it's humorous, but it's about relationships, and relationships are very fundamental. Next slide, please. Again, career development, another factor we knew before. Hey, listen, job security is going to be the big issue now for the next year or two, right? And forget about being over promoted and everything. Fear of redundancy, all of that kind of stuff. Fear of losing your when you're furloughed, losing your job. This is the biggie. So we all have to. And let me show you. Next slide will show you how important it is. Look at this during the recession. That's what we found. That's what the Chartered Management Institute found in 2010, right in the middle of the worst recession we've had in a lifetime. This other one's going to be even worse. But look at the change. As you've gone from 2008 all the way up to 2010, you saw the levels of job security in the country dramatically drop. Okay, next slide, please. Oh, I love this because this came out of Buffalo, the newspaper in Buffalo. I love this. This, again, was in the middle of the recession. I'm showing you this because this is what we're going to experience going into it. The bad news, Johnson, this is the boss. You're being let go. The good news, I give you your old job back at half your former pay. I can't live on that. The rest of the good news, we can offer you a second job also at half your former pay. At the bottom it says, I'd offer you a third, but I'm afraid of overheating the economy. So insecurity leads to these kinds of things. Next slide, please. So careers and organization structure and climate, all organizations have problems. Right now, because of the insecurity and everything else, it's really important that organizations develop a climate of participation, involvement. People are given as much information as possible. Believe me, even if the information is not good news, it's better giving being honest with your employees and giving them the bad news. Because listen, this is not going to be easy for any of us. And the more effective you communicate and the more honestly, the better it is. Next one. And this is another issue. We have work-life balance. This is good news in a way. I think here's what the future is going to be. This was a real problem before, the interface between work and home, because people wanted to work flexibly, but men, as I said earlier, couldn't, or felt they couldn't because it would adversely affect their career. That's what our study found. Major finding. Men did not take flexible working, even offered by their employers, because they thought that was it for their career if they did. Women took it of necessity. Okay, now we have work-life integration. I think we have that. I think it's here to stay. Future will be this. People who have to go to the coalface, taxi drivers, doctors, nurses, paste assembly line workers, you can't do anything about that. They have to go to the coalface. We're basically a service-based economy. The bulk of people could work exclusively from home, but they don't want to. They want to have an office place they go to from time to time. The schmooze to talk about Manchester City Football Club, to talk about Boris Johnson, to talk about Trump, and what is he up to? Does he really have COVID, etc. All that kind of stuff, which we do. We're human beings and we talk about this kind of stuff all the time. Okay, we need that, and we also team build, and also younger people who are within 3 to 5 years of their training need to get, in my view, need to be in a central office environment to learn from others. That's kind of be critical. So there are some people who need to be there. So this is a big issue. I think what happened in COVID is good news, not bad news from this. So we got at least a good thing that's going to happen. Maybe we're going to have more of our life in our control than we used to. Next slide, please. Okay, so those illustrate most of the issues. So we're going to have major overload because there's going to be fewer people. We're going to have job insecurity, etc. So we need the line manager from shop floor to top floor has to have the kind of social, interpersonal, emotional intelligence that's going to, we desperately need it. We need the business schools to do it. We need the training people and HR people to do it in the workplace. And most important of all, what we need is we need to recruit a different kind of line manager in the future. So currently we have a lot of managers in an organization. I'll say let's say that 20% of them have natural good people skills. Not been taught anything. They just are good people. Okay? That's great. I should think another 50% are trainable. They have great technical skills, but need development. So that's great. So we train 50%. Then there's about 15, 20%, 10 to 15, I don't know what the percentage is, who shouldn't even be near people. They're totally untrainable. And companies just have to start doing audits of all of the EQ skills, the social management skills of their people, and see which ones really should be put in a technical role and never put near people. Because there are some people just like that. They're technically great, but people incompetent. And so we need to do this auditing and then doing the kind of training it needs. Okay, so this is what interventions we need to improve, enhance well-being in the workplace. We already have let's go at the bottom, tertiary. We already have EAPs, employee assistance programs, counseling services, and we're going to need those, aren't we? And we're going to have to make sure that people have access to them, particularly if they're working more remotely. Second of all, we have to do the training. The training I just talked about, whether it's for managers, much more EQ training, resilience training. The evidence is on resilience trainings, it does work. Ivan Roberts and I published a paper in JOOP. We did a systematic review. It does work. Resilience training does produce some goodies. And then most important of all, what we need to do is primary, which means we have to do well-being audits of our employees, particularly now, particularly as people are working more remotely, particularly as we're entering a recession, particularly as we're going into Brexit. We need to find out on a regular basis, in real time, what people are experiencing. We have the technology, by the way, to measure that. It doesn't have to be just a one-off employee survey. It's got to be pretty precise. It's on mental well-being factors, how you perceive your role, how you perceive your manager, your line manager, how you perceive the communication systems, how you are you allowed truly to work flexibly, all that, everything I've just been saying. So that goes in doing audits, and we need to find technologies to do that on a regular basis, and we can, because we have these funny little things called mobile phones, right? We have, like Robertson Cooper is a University of Manchester spin-off company that Ivan Robertson and I founded in 1999. And we have worked with some employers where we put stuff on this where people can access it anytime they're feeling stressed out, and then quickly give us the reasons for it, because we have the technology to do that. We need to get it in real time. We need to know what's going on with people, because a lot of them are going to be working substantially from home. So that's the thing. We need to do primary, secondary, and tertiary, right? And most organizations have the tertiary. Most organizations are doing some training. Also, the training is going to all be online probably for quite a while now. But we need to do it, and we need to develop people. But we need to do face-to-face from time to time. I think it's important for people's mental health that people come into a central office from time to time in the safest way as possible. Next slide, please. If we do these kinds of things, CIPD in 2008, in their Health and Wellbeing at Work survey, which they do all the time, they were looking specifically at well-being initiatives. What's sad about it is 60% of organizations do not yet have a well-being strategy at all. What they'll do is mindfulness at lunch, right? What they'll do is sushi at your desk, bean bags, ping pong tables. No, that is not well-being, please. We have to, I just had a PhD student that did a PhD on mental health first aid, and it does seem to have some impact. But again, we have to select the right people to do it. We have to measure it. We have to train them properly and everything else. If we don't do that, it's not going to be very useful. But most companies now do mindfulness at lunch. They'll have mental health first aid. They'll do well-being days like massages. That's not well-being. It's strategic. This is a strategic issue. This is for all of us to do now. And when you look at the survey that was done in 2008, and they have one just coming out now as well, when they look at these programs, 44% better employee morale, lower sickness absence rates, lower presenteeism. We're measuring presenteeism now. By the way, the CIPD does as well, because we think that's very significant. And therefore, we need people to talk about the issues they have rather than keep it buried and turn up to work and burn themselves out. Next slide. Again, PwC, 55 companies. Again, That's the average. It does these strategic interventions, i.e., not lying down and meditating over lunch, but doing something strategic affects sickness absence, turnover, accident rates all the way down, even to the productivity issue, with an 8% increase overall. Next one, please. So well-being is not this. All right? This is the boss. Tomorrow is the mandatory meeting on employee health and well-being. The meeting starts at 6 a.m., so it will interfere with your sleep and not your work. Doesn't that send a message that work is more important than health? The boss, I hope so. That's the theme of the meeting. Healthy employees are unproductive. They're always exercising or eating fruit when they should be working. We prefer employees who work hard and die before their pensions pay off. Suddenly I feel sick. Right on schedule, says the boss. So well-being is strategic. It's no longer, yeah, come on, let's do a little bit of resilience training here, or resilience training as a part of a package. Training your line managers as a part of a package. Changing the culture, fine. Getting senior people to talk about their own personal problems as a good role model. All that stuff is what makes up a strategy. And this has got to be a boardroom issue now. No longer can we just do this, on the hoof and think that mindfulness is going to solve everybody's problems. And let me finally finish on this. Well-being isn't a new construct, okay? Well-being was first brought up by Bobby Kennedy, the best president the United States never had. In 1968, when he was running for the Democratic nomination of president, okay? He was giving a speech at the University of Kansas 2 weeks before he died, all right? And what he said was the following, and his speech was called Gross National Wellbeing, because at the time they were measuring something like GDP. It was called Gross National Product, which Gross National Product, like GDP, is everything we produce, everything, from toilet paper to sweeties to bombs, everything. All right, that tells you what okay. And that's what we rely on to say the health of our economy. But he said what's more important is gross national well-being. Here's what he said. Too much and for too long, we seem to have surrendered personal excellence and community values in the mere accumulation of material things. Our gross national product now is $800 billion a year. But that gross national product, if we judge the United States of America by that gross national product counts air pollution and cigarette advertising and ambulances to clear our highways of carnage. It counts special locks for our doors and the jail for the people who break them. It counts the destruction of the redwood and the loss of our natural wonder in the chaotic sprawl of our city. Remember, this was Vietnam, 1968. It counts napalm bombs. It counts nuclear warheads and armored cars for police to fight the riots in our street. Yet the gross national product does not allow for the health of our children, the quality of their education, or the joy of their play. It does not include the beauty of our poetry, or the strength of our marriages, or the intelligence of our public debate. It measures neither our wit nor our courage, neither our wisdom nor our learning, neither our compassion nor our devotion to the country. It measures everything, in short, except that which makes life worthwhile. That's a leader. Forget Trump, forget other Western leaders I won't mention. We need people in leadership position who understand that the quality of life and the quality of working life is extremely important. Thank you very much. Over to Uzma.
Okay, thank you very much, Cary. I mean, to be able to put that in that space of time, that was absolutely condensed brilliantly, and the business case could not be more clear right now for why we should be supporting mental health and workplace wellbeing. I've got a few questions that have come through. I've got one question here from Chris, who's just asking about the reference for your study on the impact of the boss on relationships. 1 minute, 1 minute. Sorry, Cary. I think we've just got you on mute. Just bear with me.
I'm unmuted. Sorry.
There we go.
It's not one study, Chris. You can get in touch with me. There are lots of studies. If you take a look at our book called Wellbeing, Productivity and Happiness at Work with Sheena Johnson, Ivan Robertson, and myself, you'll see some of the studies in there. There are tons of them. They all show the same. We all know this, that the line manager is pretty fundamental. And Sharon Clark at Manchester Business School has done a lot of work on this as well. Tons of studies out there, but it's not any one.
Brilliant. Thank you very much. We also have another question that's come in from Steve, saying focuses on anxiety derived from workplace and financial issues. Right now, there is another overlying anxiety on health, which affects some of people a lot or others a lot less. Any thoughts?
What do you mean about, is it about financial well-being?
I suppose, I think what we were getting at is saying, is there anything else overlying anxiety on health which can affect some people? But your study, what your results in your study is showing that actually financial and workplace impact is going to be the biggest area for organizations to be focusing on. I think, Steve, if you could just type back in, because
I think probably what he's getting at, there is going to be things specific to where we are, Uzma and Steve. I think what I mean by that is, hey, listen, we need to know more about what social distancing in a central office environment going to look like. How is that going to affect relationships? That's going to be really quite important. We don't have evidence on that yet. There hasn't been any studies on it because we're just going into that now as we enter the workplace. Still, substantially number of people are working from home. They're not working in a central office environment. So as they go in and they have to social distance, and how does a manager cope with people, some of whom are working from home, some of whom are working in a central office? I think that's going to be a real issue. How are they going to cope with some people? What's going to happen, by the way, is probably, given the financial constraints on organizations, maybe organizations should be more humane, and rather than dump people, think about clever ways working with their employees, maybe to cut back on what people get paid slightly. Maybe they downsize, instead of working 5 days, they work 4 so you can retain people. We need a lot of that going on, and what's going to be the impact of that if we do or we don't do that? There's so many things that are going to happen, partly related to COVID, but not entirely, related mainly to the recession and to Brexit. What are we going to do about ensuring that people are employed, as many as we can, when furloughing and the government's interventions are going to go? Because they are going to drop dramatically at the end of this month. And even beyond this month, they're not going to be very substantial, not enough for businesses. Remember, 2 out of every 3 businesses are SMEs. In the private sector, 2 out of every 3 businesses are SMEs. And they need to keep their costs down to survive, given where we're going at the moment.
Yeah, absolutely. Kelly's actually just added to that question, saying, is there a contribution here from policies that broaden diversity, inclusion, and tolerance?
Yeah, absolutely. Because we know the more diversity we have, and by the way, that's not just a boardroom issue, right? I'm really quite proud of the CIPD. We're working really hard in this space to do something about including, having real diversity in organizations, but from shop floor to top floor. It's important we have it all the way up. It's not good just to have it at the top and play a game like, look how diverse we are, but it's up there. But along the supply chain, there's nothing. We need it all the way up the supply chain. But hey, look at the studies in Norway. Norway has a 40% at the board level now, has to be diverse. Hey, that's great. And if you look at the evidence on organizations that have more diversity, that's gender diversity, that's BAM diversity, etc., BAM diversity, etc. You find their share value is higher. Their productivity is higher. People are more job satisfied. I mean, almost all the indicators go in the positive direction. We have to do that. That's becoming a really critical. And it's not just we should do it because it's politically correct. We should do it because it's right, but we should do it. But also, it hits the bottom line. So it's like doing things on Wellbeing. It's the same thing. You can say, oh, nice to do, sushi at your desk and massages and all that kind of stuff. I mean, I enjoy that. Fine. Give me sushi at my desk. Give me a massage. I like ping pong, so I'll play ping pong. But really, it's about a strategy on diversity, a strategy on well-being. I think diversity and inclusion is a part of well-being, really. It's a part of that whole creating the right kind of culture.
Yeah. And actually talking about sushi at your desk and ping pong, a question's coming from Rebecca saying, could you illustrate a little bit more about the well-being strategy and what has the most influence in that strategy?
Okay, here's really good. I mean, I'll give you a good example. There's a company, my university spinoff company, University of Manchester spinoff company, Robertson Cooper, right? We work with one company. We have a long-term contract with them. It's called Mace. They're the people who built Tottenham Stadium. They're doing Euston Station now. They built Manchester Business School, strangely enough. What a beautiful building we have now. We go to the board with there. We have a strategy we work out. They have a director of health and well-being. We've worked with her and the COO and the CEO and the senior leadership team made up of the CEO and his top guys and gals. All right, it's a construction company, big one. And we have a whole strategy. We just work on the strategy, but we also present to the board, right? So we have a strategy, and every time we do an intervention, say we're doing, looking at supply chain, because it's a construction industry, you've got to deal not only with the main contractor, but all those subcontractors. So they thought, it's not only good enough to look at us, you got to look at the subcontractors. So let's do something for them. And then we will report that to the board. We do it, and then we see, well, that worked and that didn't work. And you have to be honest. You have to say, if we're trying that intervention, like we're trying to improve the EQ of line managers, say, and we're doing training to do that, we have to collect the data. Does it work? And you'd say, oh, it works under these circumstances, but doesn't work under those. It works for those people, but not necessarily those. That's what a strategy is. Just like you say, I'm developing this product. And you say, well, we tried that product. We tried a new form of cornflakes, right? But nobody's buying it. But what if we did that tweak on it and made it a little bit healthier and took sugar out of it and did that and that and that to it and put something else in, cranberries, who knows what, then that works. That's exactly the same thing would apply to a well-being strategy. It's got to be board. It's got to be owned by somebody, HR director, chief medical officer, or director of health and well-being. That's what companies have now. They have more and more directors of health and well-being who report either to the HR director, the CEO, or the chief medical officer. But if we don't do that, and they have the data, Mace has the data on the impact it's had. It's had amazing impact. But not everything works. You have to be honest. And if it doesn't work, you've tried something different.
Absolutely. So I've got a question actually for you. You mentioned the flexibility and autonomy. What about those industries where, especially the creative industries, where people getting together, they're starting to feel like the working from home is affecting that? And there are some industries where they can't have that flexibility yet. We haven't quite figured out how they can do their jobs. How do you see that impacting them, or any advice for them?
Yeah, but even in the creative industries, they need to get together. I totally agree with that. That's why I was saying very few people want to work exclusively 100% from home. We've been forced to do this, right? There'll be younger people who need to be in full time, right? Even though there's a COVID risk. There are people who need to be in because that's where the creative juices come from, working with colleagues. But creatives don't work every day creatively, unless you work, I guess if you're for the BBC, then you have to be, but even the BBC, a lot of people during this period of time were broadcasting from home. We're developing their programs from home. Some of them they couldn't make television program, series and things like that. I think you have to be practical. And there are certain industries which require the juices, but say you work in PR or advertising or one of the creative kind of areas, you're not creative Monday to Friday, 9 to 5, right? But you can go in, do things for a day, come back and then do the backroom stuff you need to do, and for a couple days, and then go in again. You find what works, but you minimize at this point in time the risks, because we do have risks. When we have a vaccine, that's a different matter.
Thank you. Cary, there's a question that's come in specifically asking for university environments, and I'm going to ask this question to see if the answer is different and also what you would do yourself. Question was, any insights or stress management strategies for those working at the university environment at present?
Wow. Well, what universities are currently doing, most universities don't have a strategy at all. I'm afraid our sector is pretty poor. We don't see this as a strategic issue. I'm afraid it's still mindfulness at lunch. They do have counseling services, right, which I think is important. Some of them do better than others, but primarily we're not. The higher education sector is pretty poor. Pre-COVID was poor, right? COVID, we're trying to just cope with everything. And we do have a problem here. I think we have a problem not only with our students, but we have a problem with our staff. And even the counseling services, many universities are not differentiating a staff member from a student, because I think they should be separate. So if you have a counseling service, that should be separate. Students should have their own, and that's one-to-one. But when you're talking about a staff member, that's organizational in lots of ways. So we ought to have separate, and a lot of them don't. They use the counseling service. And I think that's a mistake, because workplace counseling is slightly different from counseling a student on a one-to-one kind of basis. And then the other thing we're not good at is who's in line management roles. We select them on the basis of technical skills, not their people skills. So we do have a problem. We're not strategic, but we have to be. And now we really have to be, because still universities, a large proportion of their staff have been told to work from home. Because if we all came in and the students are all in, we're going to have a real dissemination of the virus. We can't afford to all come in. We need to work substantially from home, I think, the staff, where they can. But we need a strategy, and we just don't have a strategy. I think most universities don't have a strategy.
Yeah, oh gosh, yeah. I think everyone's still in that stage of trying to figure things out. So hopefully listening to your talk today is going to give them that reassurance with the evidence behind it. We are getting towards the end. We've got lots of questions still sitting in the Q&A. So what I'm going to do is I'm going to encourage, we have got a networking room that we are going to be opening up. You will receive the link shortly in the chat box function. I'd encourage all of you to come and move over and join us in there, where we will go into breakout rooms and further discuss, because there is so much sharing going on between all of you on the side. I could listen to you all day, Cary Cooper. Thank you so much. I'd just like to say a few thank yous, so just bear with me. So for those of you who would like to take this further or would like to watch this again, because I'm sure there's lots of bits of information that you'd like to hear again and jot down the evidence. Reminder, you can catch this talk again between 6 and 7 o'clock. Gonzalo will be posting the link shortly for the networking room, and I would just, so that'll be coming shortly. And I just also, we are going to just about to play you out a video, which is for the Excellence in Health and Wellbeing Awards. And the second set is after for collaboration. I just would like to say, I know you can't see everyone, Cary, but there is so much love in this chat about your talk. People have really enjoyed it. And thank you so much again for joining us, and for all of you. Stay tuned.
Thank you, Uzma. Take care, all. Have a good conference.